Hello, I'm Dr. Bleu Schniederjan at the Panhandle Weight Loss Center. Today I want to visit a little bit about regaining weight after a sleeve gastrectomy. First thing I want to just visit about, and when I sit down with patients from the beginning, is emphasizing how important long-term eating healthier and exercise is. Without making those lifestyle modifications, it doesn't matter what surgery you have, long-term we can regain weight if we don't make those changes. Now, for patients who have regained weight after a sleeve gastrectomy, there's several things that we can do. Usually we start with doing an endoscopy to see if the sleeve or the pouch is stretched. The second thing that we do is we usually look at your metabolism to see long-term what we can do to help as far as developing a plan. Now, usually the recommendation, if a patient needs to lose anywhere from 30 pounds or more, is converting a patient to a duodenal switch. A duodenal switch is the most effective, durable weight loss surgery that exists. If a patient has had a sleeve gastrectomy, this surgery can be easily performed. Now, what a duodenal switch is two things. Number one, it's a sleeve gastrectomy, which most patients, if they're considering a revision, have had the sleeve component. Now, we do an endoscopy to see if their sleeve needs to be re-sleeved or if there's any part that we need to reduce to make it smaller. The second part of the duodenal switch is an intestinal part. On average, patients have about 21 feet of intestine. When we do the duodenal switch, we basically make it where we use about 10 feet to absorb our food instead of 21 feet. Now, the significance of this is two things. Number one, hormonally it has been shown that by doing that, it increases a patient's metabolism. Number two is you don't absorb as much of what you eat. The effects of this surgery it is very effective. On average, patients lose about 70% of the weight that they need to lose long term. The second thing is this occurs over about a 2-year period. And the last thing is it's very durable. Less than 5% of patients long term can regain their weight.